In the world of wound care, healing is not just about closing a wound, it's about restoring vitality, reducing pain, and preventing complications. What if healing could be faster, cleaner, and smarter? Welcome to the science of systemic enzyme therapy with Tibrolin. Introducing Tibrolin, a scientifically designed systemic enzyme therapy that redefines the healing by going beyond symptom control to address the root mechanisms of inflammation, necrosis, and tissue regeneration. Tibrolin doesn't mask symptoms, it intervenes in healing. Designed for complex wounds and post-surgical recovery, each enteric-coated tablet delivers a powerful blend of trypsin, bromelain, and rutoside, with high proteolytic activity for targeted, effective wound repair. Let's begin with bromelain, a proteolytic enzyme sourced from the pineapple plant. It debrides necrotic tissue gently without harming healthy cells. But that's not all. It also decreases edema, enhances microcirculation, and even boosts antibiotic penetration. With proven anti-inflammatory and analgesic actions, bromelain not only calms inflamed tissues but also improves healing conditions, especially in burns and soft tissue injuries. Next, we have trypsin, a serine protease that breaks down fibrin, a major roadblock in wound healing. It promotes circulation, enhances phagocytosis, and curbs necrotic scarring, thus creating a cleaner and healthier wound bed. By resolving edema and hematoma and limiting necrotic damage, trypsin transforms inflamed, swollen wounds into active sites of repair. Rounding off the trio is rutin, a bioflavonoid with vasoprotective, antioxidant, and anti-inflammatory effects. It enhances scar strength and modulates the oxidative burst of neutrophils, ensuring that inflammation resolves efficiently, not chronically. Wound healing unfolds in three distinct phases: hemostasis, inflammation, proliferation, and maturation. On a cellular level, Tibrolin supports each phase of healing by enhancing clot formation, clearing necrotic debris, and modulating inflammation, creating a pro-regenerative environment without the side effects of steroids or NSAIDs. Tibrolin targets inflammation through 8 distinct mechanisms. These include altering platelet adhesion molecules, inhibiting pro-inflammatory cytokines, and scavenging free radicals. Together, these 3 agents form a synergistic blend. They mimic and enhance the body's natural matrix metalloproteinases to selectively digest necrotic tissue, remodel extracellular matrix, and stimulate angiogenesis. By degrading pro-inflammatory mediators, Tibrolin minimizes edema and supports healing, offering critical support for complex or non-healing wounds. But what if we could make this powerful trio even more effective? Introducing Tibrolin D, a strategic evolution that integrates enzyme therapy with one of the world's most trusted NSAIDs, Diclofenac. Tibrolin D leverages Diclofenac's anti-inflammatory and analgesic power, while enzymes accelerate healing, resolve edema, and improve circulation. Together, they provide dual action, symptom relief and tissue regeneration. The following section highlights Tibrolin's real-world impact, reinforcing its clinical relevance with positive results. In a Phase 4 clinical study of 200 post-surgical patients, Tibrolin was compared head-to-head with trypsin chymotrypsin. Both groups received 2 tablets, 3 times a day, for 7 days. The study closely monitored safety, while also tracking how well wounds healed and how much pain reduced using the numerical pain rating scale. Tibrolin demonstrated significant healing with no treatment-related adverse events. Importantly, there was no statistically significant difference between the groups in terms of pain reduction or wound healing scores. Pain reduced by 85%, and Tibrolin was rated as good to excellent by 87% of patients and 94% of investigators, confirming its clinical utility. In another study, Tibrolin D was compared against Diclofenac 50 mg in another cohort of 200 post-surgical patients. The same open-label, randomized, prospective design and dosage regimen were employed. Again, the primary objective was to assess safety, with secondary outcomes focusing on pain and wound healing progression. The study found no treatment-related adverse events in the Tibrolin D group. Both treatment arms showed significant improvement in wound healing. As with the previous study, no significant difference in efficacy was detected, pain and wound scores were comparable. What sets Tibrolin D apart is its dual mechanism, a combination of NSAID for pain and inflammation control, paired with proteolytic enzymes that accelerate tissue recovery. Patient outcomes echoed this clinical promise. Pain scores dropped significantly. 91% of patients and 96% of investigators rated the therapy as good to excellent. Tibrolin D is not just safe and effective, it's well tolerated, clinically robust, and gives patients and doctors a reason to be confident in recovery. In summary, Tibrolin redefines healing. With natural enzymes, scientific backing, and exceptional tolerability, Tibrolin and Tibrolin D don't just heal, they empower healing.